Obviously, we've laid out that tibial bone stress injuries are a big consideration here, and that posterior medial tibia, that inside of your shin, is the most common location, particularly in this distal to mid third of the shin. So this is where we can expect a lot of bone stress injuries to happen. These are generally considered low risk, which means they don't have a chance of necessarily progressing to a much bigger injury very often, and they often can return to sport fairly well. These will often have that insidious onset, pain with impact, and pain after loading at rest. The real hallmark signs are really sharp pain and an inability to jump or hop with marked pain at rest or at night. Other considerations are a high-risk bone stress injury, such as an anterior or an anterior medial bone stress injury. And we do need to strongly consider these because this patient is complaining of anterior medial shin pain. So discerning if this is a high-risk bone stress injury is vital because the management is completely different and the risk profile is completely different. About 25% of anterior tibial bone stress injuries won't return to sport, and about 40% can have severe complications such as refractures, non-union of a fracture, or completed fractures. In my reviewing of the research, about 15 out of 150 cases will progress to completed fractures, which means about 10% will complete or displace. That's not a good outcome, and we need to be very delicate in managing those and screening for them. Now, in saying that, it's not impossible for us to complete a posterior tibial stress injury or a posterior medial tibial stress injury, although I've only heard of one patient in the research or from anyone really completing one of these, and that came out at the end of this year. There are other tibial bone stress injuries and shin bone stress injuries to be aware of, and it's important we understand that these can happen basically in any bone at any location if we overload that area and don't allow recovery. But just being aware of these different locations and their risk can really help us in managing these injuries appropriately. So take your time in taking this in. Some other things that can cause medial shin pain are potentially a medial calf strain, be that the soleus or the gastrocs. The gastrocs is more proximal and generally will have a sharper quality of pain. And in this setting, this patient's pain is below the gastrocs and he is experiencing sharper pain, which is unlikely to present with a soleus calf injury. That's generally that insidious onset dull ache or tightness. So that sharper quality means it is less likely to be the soleus. Now, in terms of clinical tests, we've got some great ones that we'll run through later for discerning if it's a calf strain, but just based off the symptoms alone, it is already quite unlikely to be a calf injury. Something else that we need to consider is potentially a neurological or neural injury, where we can have tingling or burning or shooting electric symptoms, nothing that's been described so far, and then we can have sensation or muscle power loss and reflex changes. However, in this setting, again, this seems quite unlikely given the pattern of pain and the symptoms presented. Likewise, a diagnosis to consider that is unlikely in this setting is a vascular one, where we can have that increased pressure and aching as we continue activity with some neuroscience often, but generally this won't cause pain at rest or prolonged symptoms, and is not often in that sharp impact related nature. So this is something that, whilst possible, is unlikely in this patient. The most likely differential diagnosis in this setting is medial tibial stress syndrome, or MTSS. This will often come with that diffuse shin pain with loading. It has more of an aching quality and is generally more stable and non-progressing. And we do have some great tests to differentiate between medial tibial stress syndrome and bone stress injuries.